Hi, everyone. Thank you so much for joining us today. I am joined by Dr. Annette Ticoras. She is the owner and sole advocate with Guided Patient Services. Guided Patient Services has been serving seniors for the last 6 years. They do have multi-state capability with some remote advocacy opportunities as well. And Dr. Annette Ticoras is here to speak about how to have an open and honest conversation with your doctor and be an advocate for yourself. So Dr. Ticoras, how much information should our seniors be giving to their doctor's office when they call to schedule that initial appointment?
Well, obviously it would depend a great deal on what type of appointment you had in mind. If this is a first appointment to meet a physician, you obviously, I think that the receptionist would know that, but you want to be able to share that with them. I'm a new patient of Dr. Smith. My goal is to come in and get to exchange information and see if we're comfortable working with each other, or if you have an acute problem and you're seeing someone for the first time, you'll want to make that very clear too. One of the interesting things that has happened through Medicare that people find themselves often confused is that idea of an annual physical where you kind of go over everything and you do everything. And when somebody sees a physician for the first time, they assume that that will be the full comprehensive exam and history taking, and then you'll bring up all the current problems that you have and you want to have addressed. And those no longer are done together as this big comprehensive. In fact, they will share with you that if you have an acute problem, you'll have to make a separate appointment for that. And I have a lot of seniors tell me that that kind of surprised them, that they had saved up some of their issues and then they were having their first appointment and they thought that everything was going to be addressed. And because of billing and coding, that can't be. So if you're new, let them know that I've got a specific concern, and I would share what that concern is. Maybe my blood pressure has been running higher and I haven't seen a primary care or cardiologist for a while. And I want to talk about whether I need to change my medicines. If you're just there to meet the doctor, make it clear that you're just there to meet the doctor. I wouldn't give too many details. You're not talking to a clinical staff person, but I would give enough detail so that you're certain that you get slotted with an appropriate time so that you don't feel rushed and your physician doesn't feel pressured because there's too much to cover in too short a period of time.
So let's say they make their initial appointment and the physician that they meet with, they just don't connect with for one reason or another. How much leeway do they have to ask to see another physician in the practice, and how would you recommend a senior going about that?
The first thing I would want to really consider, and maybe this would be something that you would talk over with a friend, find out really what was the issue. Were you pressed for time and you didn't feel you were being heard? Was it more that the staff didn't make you feel welcome? Did you not feel as though you had an opportunity to speak? Really kind of try and take the appointment apart and figure out, was there really an irreparable problem with the encounter, or was it just, happenstance, and that, you really need to probably give it a little bit more time to see if you could kind of work out the kinks and get to a place where your personalities are complementary. If, however, it was just a disaster, I would certainly encourage someone to, look elsewhere. It can sometimes be difficult to choose another physician within a group. I know there are several groups in Central Ohio that if you want to change to one of the other individuals, you will not only need permission from the one you're leaving, but you'll need permission for the one that you're wanting to change to. And that gets really uncomfortable because you're probably going to be asked why. Why are you jumping from one person in our practice to another? Again, if there is a reason, feel comfortable, you can be vague about it. If there was a problem, obviously with staff, then, just changing your provider is not going to change the staff. And then you might want to consider a different location or a different office altogether. Or if you're not quite certain if it was as bad as you felt when you were there, take someone with you and see how it feels when there's, maybe somebody else there who can, kind of help you along, kind of make you feel more confident and comfortable because you're not there alone. I've also found, unfortunately, that sometimes the appointments go better when somebody's in the room. I have found at times just when I'm on the phone with a client, the tone will change. And this is very unfortunate, but the tone will change when the provider is aware that somebody else is listening in. Kind of everybody puts on their best behavior when they know that, there's more than one audience participant.
That brings me into my next question. I do want to talk about a little bit of how things have changed with COVID-19. What precautions should seniors be taking, and is there still an option to take someone with you to an appointment? What kinds of things should they be expecting to have changed now with some of the new COVID-19 policies and procedures?
That's a good question. A lot has changed and a lot has stayed the same. So I'll start from a safety standpoint. I want to underscore that it is very safe to resume healthcare as you knew it. I myself didn't go to the dentist. It's time to have my teeth cleaned. I mean, you can't postpone indefinitely some of the preventative measures. Need to have our mammograms. We need to have, if you're a diabetic, you need to be going in and having, your foot check and your complete exam by your endocrinologist. You need to go in and have the lab work done. I think some of the unique circumstances are those who are immune compromised, and I certainly can appreciate where they're coming from. But again, accommodations have been made. Either those visits have been changed to virtual visits. They've given them options to select where they would go and have their labs done, so they can go in the very early, like as soon as the lab opens and there's the fewest number of people there, that the facility has just been cleaned, not that it shouldn't be all during the day, but you're kind of walking in at the very beginning of the day, and probably your exposure is as optimal as it can be. In all circumstances, for a while, virtual was the only option that we had. I know a lot of seniors are very intimidated by that. They were struggling to figure out if they were tech savvy enough. At the same time, the doctor's offices were trying to figure out if they were tech savvy enough. I think that the providers have figured out their kinks and they know how it works really well, and they're able to be more supportive of patients. Like, don't worry, you just need to do this and this, and we'll help you from there. I think we might return to that a bit this winter if things start to, the numbers start to change with flu and COVID. So I think people need to be prepared and open-minded to this option of telemedicine. If most of your visit is spent exchanging information, that can be exchanged very easily on a phone call or a video call or a chat. I've encouraged a lot of folks did not set up their portals because they didn't want one more thing to have to be doing, or exposure to, potential scams or whatever. They just aren't comfortable with the internet. But it's a very safe and very responsive way to get an answer from a physician. So I've tried to encourage folks, if you don't want to use the internet for anything else, maybe just set up your portal. It's a way to ask a question. It's a way to share blood pressures, blood sugar results, and that also is an easy way for that physician or provider to give you a response in a real timely fashion, in a way you can see and you can copy and you can refer back to. So I think there are a lot of options for how you can do it and be safe. I think it's really important that you know that if you go into a facility, I've been into a couple facilities, it's, every fourth chair, and it's clearly marked, and there's do not sit here and sit here. And as soon as you go back, someone comes out and cleans your chair. If you come in your cutely made homemade mask, someone is going to swap that out for a hospital grade mask. And the 6 feet is certainly being honored. I just can't say enough about how safely I have seen the facilities preparing for patients coming in. And I would encourage you to take have faith and feel as though you can trust the situation and get that routine or the routine health or your ongoing health concerns addressed.
Thank you. So what if our seniors are beginning to feel overwhelmed by advocating for themselves, or if they have a loved one that's trying to advocate on their behalf and feel overwhelmed? What are some of the options that they have? I know you mentioned the online portal, and I agree. I know that that's a wonderful tool, and I use it myself as an advocate for some of my own family members. But what are some other kind of tips and tricks that you can tell our seniors and their loved ones about advocating for themselves?
Well, I know that it's been tough because a lot of people even had worked out. I always take my sister, I always take my neighbor, I take my daughter. And then we had a while there where you couldn't take anyone. And then there was always telehealth. Then we slowly were back in the office, but no one else could come back with you. And I think where most places are right now is that you are allowed one person. So obviously, if you're in the middle of, I wouldn't say a health crisis, but yes, a health crisis as well. If you're in the middle of working something up or seeing something through, to have that partner who's going to partner with you, who kind of was there at the last appointment and has heard you talk in between appointments, and that you felt comfortable updating on what information you've gotten back or what they've said, or maybe a new prescription that you're taking and how it's making you feel. So if you've got someone you're sharing kind of your day-to-day experiences with something, that's a wonderful person to take with you, because if you get a little nervous or you get a little distracted when you're in there, they're going to lean forward and say, Marge, remember you told me that, once you started taking that new prescription, you noticed that you started to cough now, and you wanted to bring that up when you came in. So it's another pair of ears to listen, so that you're sure you really heard things the way they were said, not the way you feared they were said. It's another person to help voice some concerns if you get stuck or you get nervous or you get distracted, or it's good to have two people there. If you don't have that option, you may have the option of recording the appointment. I always encourage people to let your physician know. There are a couple of apps out there that allow you to do that as well. You can record your appointment, and then it is the recording can be sent to family members. So say maybe you've got children who are interested in, what the oncologist said. It's simple app on a smartphone. You press the button, and then that recording, following HIPAA compliance and is very safe, then gets disseminated to people that you've chosen. The sun just came out. And then another way is to have someone on the phone with you. If you find that you're not able to bring some with you, is have them listen in, put them on speakerphone. You can always consider an advocate, a professional advocate, if that's something that you're interested in, especially if you find yourself as somebody who's aging solo and you don't have that person to reach out to. Even if you have that person on the phone, which is what I've done a fair amount of during COVID, is just listening in. Maybe it's a care meeting for a loved one who's in a facility. Those are a beautiful opportunity where we're all on a conference call and we're all listening in, and various persons come in and speak about the issues at hand, and it gives us all a chance to hear it and process it. And when I'm there, able to think of some questions that maybe are outside the box that wouldn't have been thought of ways to optimize. I think that with loved ones in care facilities, this has really been a challenge during COVID. There are no eyes on, there's no boots on the ground. You're kind of at the mercy of what information slips through or that your loved one's able to share. A lot of people don't have smartphones or video capability. The facilities don't have the capability to provide that kind of service to their residents. So again, I think that's a good time to have somebody who's advocating with you to make certain that they're checking through the boxes, that, if somebody's receiving therapy, that they're making the progress that they're supposed to make, and that somebody's being held accountable to to that process. If they need to be having appointments and now you have someone in a facility who's needing to do a virtual appointment, you need more sometimes than just somebody handing them an iPad and letting them take their appointment. You need somebody who's able to know what the appointment was for, know what needs to be covered, know what issues. You don't want to end the appointment and have not covered the following things. And then again, because there's so few people who have access to the resident and the care team in a facility, how are those orders being carried out? Did someone make that next appointment? Did someone put the lab order in? Did someone make the change in the medication? So sometimes having a professional step in, at least during trying times like this, to make certain that things are being completed can be very valuable.
Yeah, I can definitely see that. Do you have anything else in regards to being your own advocate that you'd like to share with our seniors and their loved ones?
Well, I think that Katie shared with me that she's going to be attaching a PDF, which I reviewed, and it is phenomenal. It is very, very thorough. There was nothing left unsaid if you take time to read the PDF. But some of the high points there that I think people overlook that are quite simple is just writing things down, making certain that you're as organized as you can be when you go to an appointment. And that's where you have to start to assume responsibility, which is a little bit different than maybe you've been before in your relationship with a doctor. They asked the questions, you did the answering, they said what was next, you followed along, they told you what to do and you did it. I think more and more folks are wanting to be empowered, and they feel that it's essential to be if they're going to get good care and make certain that they're getting appropriate care and accurate care for what's going on. So coming prepared, having your own agenda. The doctor may have his agenda or hers, and it's to get through the last 3 problems you had when you were there, but you've had 2 new problems creep up that they don't even know about. And if you let them kind of run the session, you'll find that they're done and the time is up. And that's when you say, but I had 2 things that I wanted to talk about. And they're like, well, we've run out of time for today. You're going to have to schedule another appointment. So be prepared, make certain, you can't go crazy. You can't have 5 new things, maybe have 3 on the list and hope to get through all 3, but maybe only 1 or 2. Know your medications. Don't be fumbling around and spending time trying to think of a name of something. I always encourage people just to put the bottles in a Ziploc bag and come in, because there's a lot of information there, not only what the medicine is really called, what the dose really is, how you're really taking it, who prescribed it to you, when you last filled it. So are you taking it appropriately? Because you should only have X number of pills left. Do you have refills so you don't get home and turn around and call back 2 days later and want to refill? So having your medications, having your agenda, writing things down. If something gets said to you that you don't understand, ask for it to be said again, ask for it to be spelled. If it's something entirely new, ask, is there somewhere that you would recommend I look that up? Like, what's a good resource for me? So whatever that might be. I mean, maybe you've been sitting on that bubble of pre-diabetes and you haven't done any reading because you really just didn't want to get ahead and you thought that you weren't hoping to head that direction. But now you've been told that you do, and they're going to send you to diabetic education once COVID is over. But you want to learn how to best take care of yourself. Then ask, where's a good resource for me in the interim to learn more about this disease and what I can do for myself? I think your provider is going to be thrilled. And that's what I always try and make people, they're not going to be threatened by that. They're going to be thrilled that you're asking questions and that you're invested in your own health. And I hope that they answer accordingly. And if not, then I think we're back where we started. If you find that your caregiver isn't open to you being a knowledgeable, empowered patient, then maybe you need to consider finding another provider that will allow you to be that way.
Wonderful. I echo those sentiments about asking for resources. Doctors will love to give them to you and will probably send you home with more than you asked for.
Exactly, exactly. Better too much than too little.
Yes. Well, Dr. Ticoras, I really appreciate you taking time today to talk to us about all of these wonderful, valuable resources that you've discussed. And I know I feel a little bit more prepared to be an advocate in my own life, and I'm sure our seniors will as well. The PDF for the How to Speak with Your Doctor pamphlet is written by the National Institute on Aging, and it will be available following this video. Thank you so much for your time today, and stay safe.